Welcome to Inside Aesthetics, the world's leading podcast for injectors and aesthetic businesses. I'm Dr. Jake Sloan, an aesthetic doctor with over 16 years experience in facial aesthetics.
And I'm David Siegel, an entrepreneur and business mentor with over 20 years of experience in our industry. Our podcasts are aimed at industry professionals, and any information or advice given is general in nature. You should consult with a healthcare provider before undergoing any treatment.
You can also subscribe to us on Patreon for on-demand content for injectable and business education.
All right, today we are joined by our friend all the way from Cape Town in South Africa. And I'm going to try and pronounce your name. You just told me how to pronounce it before we went live. I might butcher it. Apologies. Michele Vanzaghi.
Michele
Vanzaghi.
I mean, you got it spot on.
Oh, excellent.
Well, welcome to chapter 23
Yes.
of the Injector Diaries. Now, we're going to do something slightly different this week. We have realized our intros are getting longer and longer and longer. So we're going to try and keep it short, but we do have just a quick, a bit of an update about what's happened with our subscriber only episodes. So if you're new to the podcast, starting a few episodes ago on episode 265, we've now divided some episodes into two halves, and part 2 is exclusive to subscribers to our Patreon. So if you like these episodes and you want to get part 2, just look at the podcast description down below, and you can get all the information on how to subscribe for those episodes.
Yes.
Now, another thing that we wanted to flag, and we're still trying to work out how to navigate this, you might have heard about this. So Apple...
We're getting screwed by Apple.
Yeah, they're going to be charging any app in the iOS sort of app store. If you sort of purchase an app and there's in-app subscriptions like our Patreon, Apple are going to take 30% of those fees, which is a bit of a kick to the balls, if I'm honest. So we're trying to work out a way of navigating that. And we think we've got a bit of a clunky but a workable loophole. Essentially, we don't want anyone new to our Patreon to sign up on an Apple device. That's the way around it.
After November 1.
After November 1st. So if it's before November 1st, do what you like, download it on Apple and subscribe as normal. But if it's after November 1st, the only way of navigating to avoid a 30% fee that we'll have to absorb is to sign up either on an Android, a non-Apple desktop, laptop, use your dad's phone or just someone's phone that isn't Apple. And then once you've subscribed, then you can download Patreon on Apple and use it as normal.
Yeah.
So sorry if that's confusing. We will publish more information
Yes.
as we get that.
Yes. Thanks, Apple. Thanks for making our life
Thanks,
more
Apple.
complicated than it already is. Thank you.
Yeah. Now, anyway, let's get into this podcast. So, Michele, tell everyone about you. You're one of our newish Patreons, so thank you for joining and subscribing. But you're obviously in South Africa. You reached out and said that you'd be happy to talk. You've got an interesting background, etc. So sell yourself to the masses.
Cool. Thanks, guys. First of all, I just want to say thank you for having me on the podcast. I think it's a huge honor to come from South Africa and I think showcase a little bit more about what we are doing here. I think it's probably going to surprise a lot of listeners about what's happening in South Africa. So Michele, you got a perfect pronunciation. I am a medical doctor. I graduated in Cape Town, in the University of Stellenbosch in 2018. And I went on to do my internship and community service in South Africa. And I've been doing basically full-time injecting for about 2 years now after graduating. And I think my story is a little bit more interesting and complex because of the way that I got introduced into the aesthetic world, this crazy world of injecting and this completely different sphere of medicine. I was actually, to put it very blunt, I'm sure we're going to talk more about this, but I was diagnosed with testicular cancer in my first year of medical internship. So sort of the end of the first year, 1 year after graduating as a medical doctor. And I never really knew which path I was going to take in medicine. I knew that I was interested in hands-on discipline with a little bit more, hands-on approach to medicine where you're actually doing something that's actually physically, tangible and malleable. And I've always been very aesthetically driven. I'm interested in the world of aesthetics and I think what was interesting about my journey and my story is that during my time of chemotherapy, more than all the other side effects of chemo, it was the one thing that really got to me was the physical appearance. It was the loss of hair. It was the way that my body looked and how that made me feel. And I think that I didn't really realize it at that time, but I think that was a pivotal point in me deciding to go into aesthetics. And it's a difficult decision for any medical doctor. I think everybody I've spoken to says that it's a difficult transition to go from clinical medicine into full-time injecting. And the more I think about it, I think that journey really helped me to see the value of what we're doing and make that transition. So that's kind of my introduction to aesthetics. I've been working in a sort of a chain or branch clinic. I'm one of 8 doctors in Cape Town, and we all do full-time aesthetics. I think we'll talk more about it. It's called Skin Renewal. And yeah, the journey's been super interesting, and I really can't wait to dedicate the rest of my life to this beautiful profession. And I'm just happy to talk about my journey.
Wow. So being diagnosed with testicular cancer, do you want to just expand on that a little bit? Maybe it's uncomfortable for you to talk about, but what's that like, getting that diagnosis? I mean, we heard these stories. I mean, cancer is so prevalent everywhere around the world, which it was kind of terrifying in its own right. But how do you sort of respond and react, and what's going through your head when you get that kind of diagnosis?
So it's an interesting thing that happens when it's yourself. Interestingly, in medicine, you're usually the person giving out bad news. And to be the receiver of bad news, I kind of went into this fight or flight response where I didn't really think too much about all the negative and all the hardship that came along. And I kind of went into this survival where I was like, okay, this has happened. Let's, what's the next step? What happens next? Where do I go? And I think the process, because it's such a prolonged process of treatment and, continuous surveillance and monitoring, that process has been a little bit more difficult. Sort of the after effect where, you've gone through treatment and you've been through that like initial fighting phase where you're like, cool, I need to do everything possible to have the best possible outcome. And then after that, when you're kind of in remission and the surveillance of it, where you start to really introspect and think about, how inevitable we really are. And as young people, I think we always think that we're we're invincible, we're young, nothing bad can ever happen. And when you go through that experience at such a young age, I think it helps you to make the most of your life, because you really then realize that you're vulnerable and everything can change very quickly. And you need to, not be irresponsible in terms of, making a crazy life, but take opportunities and do everything you can. So, my answer is always, it was a fight or flight response. The most interesting part for me was actually calling my mother. And sort of, from one day to the next, I was completely healthy and completely well. I've got no, genetic history or family history. I'm extremely healthy. I only eat cruciferous vegetables and never touched a cigarette in my life. And then the next day, I was being summoned with cancer. And then informing someone about that news, it's an interesting thing that goes through your mind. And it makes you think a lot about, how you want to conduct your life.
Yeah.
Wow.
Let's use this as a public health warning or message for men. How did you find out about it? Like, what happened, and what should men do to sort of check prior to needing, potentially chemo? If you could catch it early, maybe could help people listening.
Absolutely. And so I was 25 years old, and I had very few risk factors. To me, there was a lump on my left testicle. So self-examination, early self-examination, and knowing what to look for was honestly what I believe saved my life. Because I had very few other symptoms. I didn't have any, urinating symptoms or any pain anywhere else. I literally just had a lump on my left testicle. And it wasn't huge, it was a tiny, probably like 0.5 centimeter growth on the pole of the left testicle. And I can really not encourage young men enough to self-examine maybe once every 2 weeks after a warm shower, just to feel the testes. And I know it's such a sensitive topic to talk about, and young guys are often not very open about talking about this. But I really went on a whole year of trying to just inform people that, it's a self-examination, and 99% of the time it's going to be something benign. But if you are worried about something, just have a professional check it out. Examine, and there's lots of good information on the internet about how to examine and what to look for. And if you are concerned about anything, just present to, your general practitioner or your urologist to have it ultrasounded. And it's a non-invasive ultrasound, which can then confirm the diagnosis. So it's nothing that you have to be worried about. So what I really try to encourage people to do is to take action if you are concerned. That's the big thing. A lot of people live in denial because it's such a sensitive area.
Good advice.
Yeah. particularly men, we tend to be averse to this kind of thing. I mean, women tend to be more in touch with their body. They're more proactive with their health, but men tend to be very reactionary. So I think it's sort of a systemic problem that plagues just the male species. So I think that's a very sensible message to be talking to our listeners about. So you get the diagnosis, you go into the flight or fight response, you sort of go through the treatment protocol. I'm sure there's lots to talk about in that process itself. But then you had a realization where this event kind of shaped your decision on where you were going to take your career because of, as you said, noticed physical changes that you weren't happy about because of the result of treatment from this condition. So, at what moment did you decide aesthetics was for you? And then sort of where did you sort of begin your journey in terms of education or wanting to throw yourself into this industry? Because it's a bit crazy. There's not like a single path forward. Like if you want to go and do like cardiovascular surgery, there's a pathway that you have to go through, but not so much for aesthetics. So everything tends to be a little bit haphazard, and everywhere around the world tends to be a bit different in terms of how practitioners educate themselves.
Yeah, absolutely. So I actually came back from treatment, and I went back into working as an emergency officer in my sort of community service. I had to finish a little bit of compulsory time in casualty. And then what happened after that is I decided to move into general practice in the private sector in South Africa. So there's a really interesting thing in South Africa. We have a public sector and a private sector, and they're so mismatched. There's a huge disconnect between the two. So I decided that I knew already that I wanted to move into the private sector of health in South Africa. And I went into a GP practice. I actually went in my own little privately run general practice where I was doing general medicine. At that point, it was very difficult to sort of just go straight into aesthetics. I was always interested in doing aesthetics. So what I did was part-time general practice, and I injected a little bit of Botox, a lot like most other people. There's a lot of people that do that in South Africa. They run a general practice and they inject a little bit of neuromodulation, whatever product they want to use. And I realized that at that point that was honestly the best part of my day. I was really looking forward to those patients that were coming in for more aesthetically driven procedures. And after about 6 months of doing that, I decided that I wanted to go full time. And I approached a clinic in South Africa, probably the biggest aesthetic clinic in South Africa. And within a month, I was integrated into their team. So really nice that they take on people with very little training. And I'd done the classic 1-day course on neuromodulation and the weekend course of how to inject HA fillers. And I didn't have a lot of experience at all, but I was super passionate and I really wanted to expand that journey. And I've been with this clinic now for 2 years, called Skin Renewal. And I've been injecting full time ever since then. We're 8 doctors. We actually have 4 doctors that have been working or 2 doctors that have been working for about 16 years for the clinic. And the rest of us have been between 2 and 10 years. So lots of experience in the clinic. It was a beautiful environment for me to learn from them. And they actually host their own 3-month internal training program where you would shadow those doctors without touching a patient for 3 months. And you'd have a regular training with Allergan. Galderma came down and did a little bit of training for us internally as well. So a good platform to learn from someone that didn't have a lot of experience. And over the last 2 years, I've continued to grow and expand. And I think it's such a you've got to put in the work yourself to grow in this industry. And, I think it's so nice that there's a few of us that are dedicating our entire medical professional lives to this industry and really trying to, in South Africa especially, trying to make it a recognizable profession and not just something that people see as, an off-label or yes, that's kind of how I got introduced. I think that my diagnosis was such a pivotal moment in my decision to take that leap. And I think all of us doctors are so used to the stigma that's attached to it and struggling to make that transition to full-time aesthetics because there's such a poor definition of the profession. And then Skin Renewal was a great, introduction to everything. And honestly, we have interestingly, I think people don't see how much we actually do in South Africa, and we have availability of so many products.
Tell us about day one where you trained, because we've all done it. And, mine was 2008. Yours was, 10 years later. So yeah. What did you do? What were your feelings during it and after it? And how well or how poorly did it actually sort of prepare you for, your shadowing experience in your clinic?
I think no one will ever forget that day. The day you arrive and you realize, what am I actually doing here? I studied for 6 years, and I went through this crazy casualty time. And then after a day, you're standing in a clinic, with with a filler in your hand, and you're not entirely sure what's about to happen. So yeah, it was terribly, and it's a very scary thing to think that you're approaching a patient and you have the ability to either give them a beautiful outcome or make them terribly upset with something that's not an emergency or not entirely necessary. That was always terrifying to me, but I'm so excited by the challenge, and I love the interpersonal part of aesthetic medicine. I love that connection that we make with patients in the consultations, and I really focused on that in the beginning. I really enjoyed understanding people and how they would communicate with me about what they wanted to achieve, and then so I can only say it was pretty terrifying.
Yeah.
And I never forget the first day that I actually had my first patient. And it was a patient that came to me and said, I don't have any budget. I'm only in South Africa for 2 or 3 weeks, and I want you to just make an assessment and do as much as you possibly can. And I was here thinking, I've just come into this, my first patient that I'm ever seeing on my own. What am I going to do? And I look back at what I actually did for that patient, and it's actually quite terrifying how much you progress in 2.5 years. So, we go through so much learning every single day. I think we go through these incredible learning experiences in this industry and just continue to grow.
Yeah. Did you ever have any moments where you sort of were questioning whether you're making the right decision? I know that medicine in South Africa, especially when you're in like trauma or casualty, I have a friend who is a doctor here in Australia that was from South Africa, and some of the stories he told me about gunshot wounds and stabbings, and it's quite intense. There's quite a lot of interesting stuff and high intensity things that come in. So was there ever a moment where you kind of felt like, gosh, is this real medicine? I've gone from like saving lives and dealing with like major trauma issues to like attacking someone's wrinkle or a deficit in their mid phase. Did you have those moments where you kind of went, what am I doing?
Absolutely. I think a good example was, one day in the clinic, it was a Friday afternoon, and a patient walked into the clinic at like after we were just about to close, and they had a tiny little Spock brow from someone that had injected them, and it was this absolute crisis. And I remember just coming back and thinking, this patient was not willing to go into this weekend without, so they obviously didn't really understand how neuromodulation works, and they were just terrified by this tiny little bit of asymmetry in their face. And that was about a year after coming into injecting, and I just remember, the struggles of the people in the aesthetic industry are very different from the public sector in South Africa. But it always comes back to the change that you're making. Everybody has their own struggles in the world, and I think that for that person to correct that spot was just as important as people that are out there. Not as important, but I do sometimes have to question, am I making as much difference as I thought I would be making in the world? And after I think about it, I think I am, and I think that we all were meant to be in a certain position in medicine. So there are a few patients that make you believe that what you're doing is just vanity and this is all crazy and what am I doing? But overall, if I think about the change that we can make in this industry, it always seems to make me feel much more comfortable. And there have been a few moments like that.
Yeah, maybe we can lean into that a bit more. So you as a patient, forget as an injector, you went through a life change, physical change, lost your hair, etc. So, that change in aesthetic is obviously quite shocking and difficult for people. And I think anyone could understand that perspective. But then you have patients who have something much more trivial in inverted commas, but it bothers them. They look in the mirror and it distresses them. Now, of course, BDD is something different, and I won't include that in this chat. But I think that we should be proud, but also very clear on what we're doing as injectors. We are there to improve people's confidence, whether it's really shocking, like your own experience, or something that's just annoying and a friction point when you look in the mirror that you can improve for someone. So as a patient, how would you speak to that? Because, you went from, being healthy to not and having that change. So how would you speak to injectors who I sometimes observe being quite guilty about what they do or not quite being able to reconcile why they're doing it?
To me, the most important thing is that we need to change the way that people feel, and people that feel more confident will project themselves better in the world and accomplish more. That's really where it comes from to me. It's as someone who had gone from being popular and always, I think when you come from a position of, always being seen as an attractive person, and you get humbled by how quickly that can be taken away from you and how that makes you feel. I didn't want to go out. I didn't want to present myself in the best possible way. I didn't want to take the opportunities that were presented to me. And there was a period after even going through treatment when I came back into, normal society where I looked different. From chemo, you swell a little bit, your facial shape changes. My hair grew back, not entirely the same, and it was a little bit more sparse. And like the way that I projected myself during that time is completely different to the way that I project myself now, with feeling confident and feeling like I look like the best version of myself. And I really try to stress that to people, that we're not trying to change the way that you look, but we're trying to change the way that you feel about yourself. And that will, without fail, directly impact the way that you take opportunities and you present yourself in the world. To me, I think there's a disconnect between what people think we're trying to achieve with aesthetic medicine, is that we're trying to change people's appearances. But I really think we're trying to change the way that they feel about themselves in any way that might manifest itself.
So what treatments did you undergo? I'm assuming there probably would have been some collagen stimulation, probably one of the big ones. I'm assuming you had some wastage and loss of volume. So can you talk us through your regime and who treated you and what was that process like for you? Like seeing these changes and going from potentially not recognizing the person that you were looking at in the mirror to then, over time, but perhaps, refamiliarizing yourself with your former identity.
So, coming back, at that point, I was still very new to the aesthetic industry. So working in skin renewal, neuromodulation for me was kind of something that I'd started doing at that point. Hair treatments, I did 1 or 2 PRP treatments, which really helped the way that my hair is going back. We offer that in the clinic as well, and I think it's a beautiful treatment. Going into the regenerative space, we kind of do PRP with mesotherapy and also dermapen into the hair. I did that for my hair. And then I've obviously had a little bit of volume replacement in my face. Those things do come back naturally, but obviously at that point, I'd done a little bit of volume replacement just to give my face a little bit of structural support. And then obviously high energy devices to me was also very important. Another whole sphere of aesthetic medicine that I think is important and we sometimes overlook as injectors because we love the fun stuff. But stimulating or organizing collagen with high energy devices, I did a few of those treatments coming back. I didn't do them aggressively as I need to come back to the way that I look, but I kind of used treatments and a little bit of volume replacement with dermal fillers and neuromodulation. I've done one biostimulator or biomodulator that we call. I did one session of Sculptra as well to try and just help my skin to come back to what it was. But it wasn't really that I was trying to fight back to what I looked like. I think it was more the recognition of how I felt and why I want to do these treatments going forward for the rest of my life than, really trying to come back to the way that I looked.
Mm-hmm.
I'm curious to know about the aesthetic market of Cape Town. We've had Isolde Heydendrich on from South Africa. Have we had any other South Africans? Don't think so.
No, I don't think so.
But anyway, we've heard a little bit about that part of the world. But tell us about, who's interested in injectables and aesthetic treatments in that part of the world. And I'm more interested in the demographic. Is it a white population, a mixed population, black population? Who are you seeing and what are they asking you for?
So this is really exciting. And I think it's the way that it's growing in South Africa is it's almost, you can't believe what's happening in the aesthetic industry in Cape Town in particular. My exposure is all within the Western Cape and Cape Town. And about 50% of my patients are actually international patients that travel to Cape Town on holiday. I think given our weak exchange rate, a very important factor for them is the price point, because for the same products with very skilled injectors, they're getting it at a way lower price point. So 50% of my practice is, and I must tell you, North Europeans, Americans, and actually quite a few of South Americans are coming to see me. And we have a big group of Chinese and sort of Asian patients that are also coming to the clinic now. So interestingly, a lot of international patients that are coming in, depending on where you are practicing within Cape Town. And then the others, to be honest, in my practice have been upper middle class, or sort of the wealthier Caucasian or white people in South Africa are predominantly doing injectables. About 80 to 90% of my patients are probably upper middle class or wealthier Caucasian people living in Cape Town, or what I call the Atlantic Seaboard prime area, where, in Cape Town there's this strip of beautiful houses. And I think a majority of my patients are coming from there. But very interestingly, the Black population is becoming progressively more interested in the aesthetic sphere or the aesthetic industry. And we always make this joke, Black don't crack. Black skins are extremely rich in collagen, and they really don't get a lot of wrinkling or rhytides or volume depletion, but they struggle a lot with pigment. So they struggle a lot with pigment issues, and a lot of them are presenting to the clinic to treat that, with high energy devices and treatments with our dermatologists and our therapists. But the population is extremely diverse. I can't say that there's one type of person that I see. It's really nice that we see such a mix and interesting mix of international patients and Cape Townian patients across the board. There's not really one thing that I can say that we see. What's really nice about our practice is obviously the mixed ethnicity or mixed culture of South Africa. That we have Indian people, we have Black people, we have white people, and then we have colored people as well. And they all come with their own set of problems or their own set of complaints. And we get to see that across the board. But there's a really interesting mix of people that come into the clinic. Every day is a new journey.
And so what was your education process like once you joined Skin Renewal? How did you actually, so someone take you under their wing, sort of mentor-mentee type situation? What's that development process like for you? And where do you start? I'm assuming neuromodulators and then progressing into more complex treatments. Just walk us through that a little bit.
So Skin Renewal has its own training academy or training institute. So what happens when you join them, for 2 or 3 weeks, there's actually a support team or a team of trainers, or trainers that are employed by the business that take you through all of the technology and all of the science behind what it holds, even the injectables. So injectables, technology, treatments, and you go through learning about all of the theory without ever touching a patient. That's for the first 2 weeks. Thereafter, you actually go to the main branch of Skin Renewal, which is in Johannesburg, with the founder of CEO, her name is Maureen Adams. She's the lady that started Skin Renewal, I think like 19 years ago. And you spend a week with her, shadowing her, where you just sit with her and learn from her as she injects patients. We also have, we have talks and trainers that come from Allergan and Galderma that bring products to those companies host, and they will bring a trainer down for us. So Skin Renewal will obviously have a patient or a model, and then they'd bring down the product that they want us to train with, and that trainer will then help you to inject a patient. So that would be a bit of hands-on training. And then after that, for 3 months, you actually don't touch a patient. You will shadow one of the other 8 doctors that are working in the clinics on a rotation basis. So sort of every Monday and Wednesday and Friday, you sit with one of the doctors for a full day in the clinic, and that you just learn through experience. You learn through observation and talking to those doctors. So there's kind of like a hands-on theory training, a week of training in terms of like sitting with Maureen and watching how she injects, and she teaches you skills and techniques that she's built over the years, and then 3 months of experience with the other doctors and observing and learning from them. And then ongoing training, we have continuous training from Allergan and Galderma as well, and all the newer companies that are coming in.
That's actually really good. I mean, here in Australia, it's very variable as to what different clinics do. And of course, if you're an independent injector, away you go. You just start injecting. It seems crazy. So what are your thoughts on us? Because we've discussed this before about training and what's the best thing. I mean, 3-ish months of just shadowing. Yeah. I've not heard of a clinic doing that, which is great.
Yeah.
Because, and I'm guessing there'll be some people who embark on that and go, it's not for me. The pace of it might not be, enough for some people, and they actually drop out because they don't have the patience. So it's a good way of testing, are these injectors going to be worth training? Because if you're not prepared to do that, then what's the point in investing in them? So, yeah, I think that's pretty good. What are your thoughts?
Yeah, this is the first I've heard of that kind of intense, lengthy process where you're actually getting to watch. I guess you're then circulating with different people within the business as well. So you're seeing different things from different people. I think that's probably one of the best ways I've heard in terms of training. As you said, everyone's trying to do things as quickly as possible. Yeah. Get the theory under their belt and then just get patients in front of them. And that's one of the things that I think that potentially is overlooked. Again, someone that's not medical, so perhaps I'm looking at this from a different perspective. But like one of the most difficult things that I think would be a challenge for new injectors is just knowing what to do to who and when. It's not so much about the physical skill of injecting the product. It's just knowing different faces, what you're looking for, who to say no to, what your treatment approach or your sort of your thought processes and how you're actually planning to treat that patient. And I think you can't gain that knowledge or experience unless you've seen a number of different faces. And as a new injector, you don't have a lot of patients generally. You sort of don't have that volume of people. So your development process probably is a lot slower, but you're seeing all these patients, even though you're not injecting them, you're watching the whole process, how they're being assessed, what the treatment looks like. I'm assuming you probably were there for reviews and if there's any tweaking or fine tuning that needed to be done after that treatment. It sounds like a fantastic way to really build up a strong foundational set of skills for you to then build upon. What is that? Would you say that's fairly accurate, or and so in terms of the value and building people from a quality perspective?
I couldn't agree more. I think that the patient consultation and patient assessment is completely overlooked across the board. I think people focus so much on the skills that we need to acquire, obviously, for safe injecting. But if I look at a lot of patients that come from sort of small general practitioners that are just injecting, it's not the injection technique that's often the problem. It really is patient assessment. And as an addition to what you just said, I think understanding the patient's psychology, to me, that's always been so important, is understanding what they actually want, because so often our patients don't know what they want. There's such a misalignment about what the aesthetic industry can provide and what they actually want to achieve when they come and see you. Yeah. So I really think that for me, that's what I've really focused on. In my first year or 2 years is just making patient assessments, and going through proper medical consultations, taking medical histories and presenting complaints and building a plan, and not just, trying to see this patient once and do as much as possible and then off they go and, but they're a slightly fuller face. Or it's about making that assessment, building that relationship with these people so that you can understand them better and understand what they want, because it's not our role to impose beauty standards onto people. It's our role to understand what their beauty standards are and then to help them to achieve that. And for me, that was probably because I really look up to some of the more senior doctors in skin renewal that have been doing this for 16 years, from the onset of where they would just take a filler wherever there was a line and stick a little bit of volume under there, until we've progressed to this super intricate, really complex process of understanding patients. And I could see the transition in them, and just listening to them talk to patients and listening to the way that the patients responded to them was, I can't thank Skin Renewal enough for that opportunity to get a basic salary and to just sit and watch people inject for such a prolonged
that was my
time.
question. Like, did you have to pay for it, or were they paying you?
So there's obviously a restraint of trade that comes with that and how the business is run. But you get a basic salary, so you're not doing any work for the company, but you're getting paid, and that is obviously, we need that. We need to survive, and you have this opportunity to grow and learn. So it's a big, very important part of learning in aesthetics. I truly believe.
Yeah. I was thinking about an analogy when it comes to training, and I always go back to cars, being a male. How long does it take for you to learn how to drive a car, like an automatic car?
I did 8 lessons.
Okay, but like anyone could get in a car and push the accelerator and drive in a straight line or go around a corner.
Yeah, on an automatic, yes.
But like how long does it take you to understand like different road conditions, whether it's raining, the gradient of that road, potholes, other drivers looking ahead to see, you spot someone like a few cars ahead, you go, this person's a maniac, I'm going to stay away from this person. That's what takes the time. It's not the actual physical skill of driving the vehicle, because any schmuck can do that with a very short amount of training. It's the same for injecting. It's not, yes, there's nuance and super advanced people or, super advanced techniques require more training, but that's not what it's about. It's about all the other intangibles that you can't get unless you've experienced them.
Yeah, no, definitely. Is there a contract that you had to sign to say, we'll train you for 3 months and then you've got to be here for a minimum period because we've done all this training for you and paid you for it?
Yeah, so the business is run actually quite incredibly, and there is a restraint of trade. So obviously, there's a probation period where you go through the next 6 months, or I think it's 9 months, and then a part of your salary is attributed to a restraint of trade. So if you leave the company for 1 year, you can't build your own aesthetic company within, I can't remember the semantics, I think it's about a 50-kilometer radius of any of the skin renewal branches.
50 kilometers.
So you can't just, you can't just come in, take the teaching and bugger off,
Yeah.
But yeah, Victor is our CEO, and he's really good at I think he might have contacted you as well. To speak about the aesthetic business in skin renewal, which is completely run internally. Everything is done, training, all of our distribution and our products that we retail Neostrata and SkinCeuticals. It's all done internally within the company. So, it's kind of this whole training institute, lots of therapists with high-end devices and products. And we have a health renewal sector with a nurse that does IVs, and we run a weight loss program, a red diet. So there's, it's really not just aesthetics. And I think that gives him the opportunity to kind of do this teaching, and he sees the value of that teaching. And then there's obviously, there's a contractory thing that you need to do to enter into this clinic.
Yeah, no, Victor did reach out. We haven't quite got a date in yet, but it'll be interesting to find out more about the business for sure. Sorry to interrupt your podcast, guys. Just a little bit of news about David and IA Business. So, David, you've been doing business mentoring and coaching for around 18 months now with many of our Patreons, as well as a few outside people and internationally. And you've done a bit of a rejig of your services.
I have. Well, I've worked out that ad hoc sessions are great, which I'm happy to continue to do with random things that crop up in people's businesses from time to time. But really, I've worked out that there are common themes or common problems that people have within their practice. And I've based a 3-month or a 6-month course that essentially skills people up on all those areas that they tend to struggle with most commonly. So things like finances, operational issues, HR disasters, negotiating leases, negotiating with suppliers.
How do you do this? Do you meet people? You do it through Zoom? Is it groups, one-on-one?
I do one-on-one via Zoom. If people want to do in person, I have done in-person sessions before, but generally I'm talking to people all over the country or all over the world, so it's not always convenient for us to meet in person. So yeah, they're all done via Zoom.
So if that interests you guys, obviously there's a link at the bottom of the podcast description that will take you through to our website. There's a lot more information on what David offers, pricing, and how to sign up. Enjoy the rest of the podcast.
So this might be a question that you can't answer right now and potentially slightly unfair to ask you, but what is the long-term goal? I mean, you're a young doctor, you obviously got the world at your feet again. Is this somewhere where you see yourself indefinitely, or do you want to go and, build your own business at some point, or is the business model that these guys have created just so attractive and it can allow you to, achieve all of your financial and career goals without having to go out and do something on your own?
Yeah, it's a difficult question to...
Victor's listening, so be careful.
Obviously, skin renewal has been, if you think about the learning aesthetic medicine and learning about the business, there's no better place. And they really are a great company that I respect with my entire heart. I think that if I had to talk about skin renewal, I've got absolutely nothing bad to say. The company is run beautifully. All of the doctors working there that I've encountered, are extremely professional and really have the same ideation about aesthetic medicine as me. I want to dedicate my entire life to not only progressing my own career, but helping this industry to grow across the world into something more reputable and something more well-defined.
Yeah.
With that being said, I do think that as a young, very motivated professional, not for financial goals, but for personal goals and creating a legacy within this crazy world that we are kind of all growing in together, I would love to have my own personal thing or little child that I could take through this industry and use that to have more impact in the world.
Yeah.
So it would be more about me creating my own impact in the world if I were to go on. And I think the idea of running a business that looks into the industry and gives the industry more credibility would be something that I'd be definitely interested in doing in the future, not the foreseeable future, but in a few years or so.
Yeah, I think that's reasonable. What sort of injector are you? And what I mean by that is, what do you enjoy doing? What do you excel in doing? What do you not like doing? Whenever I train new injectors, I ask them that question. It almost sort of confuses them. Like, what do you mean? I just inject Botox and filler. But we all have a skill and a style and a thing that we do and don't like. So how would you describe your own injecting?
I think the first word that comes to mind is definitely conservative. I'm not someone that's going to do a lot at the initial consultation. I like to understand my patients and not be too heavy-handed with volume and dosage of neuromodulation. But the thing that I enjoy doing the most, and I think that's really what I think what a lot of us overlook, is the power of our neuromodulators, our neurotoxins. I cannot stress enough how much time I put into perfecting neuromodulation, because I think fillers are these really exciting things and everyone's a little bit worried about them. But what we can achieve with on-label and off-label neurotoxin is phenomenal to me. And I'm so interested in the science and the development of this medical drug that we're now using for cosmetic things. And I do bruxism, I do masseters, we do trap tox, we do headaches and migraines, and I do all kinds of, we do off-label toxin for the lower face. But I think it's such a powerful tool that I know is going to work every single time. I know that I'm going to get a result, and I know if I inject this toxin in this way that I've learned, I will give this person a result, which I find really powerful. So I really think it's been a massive focus for me. And I think that people overlook how much of a better result you can get if you understand the product and not just do, the normal recipe that's taught to us. So that to me, that kind of injector, I really love neurotoxin, and I think I want to perfect it even more as I progress. And then in terms of volume replacement, I've followed the MD codes. We all got taught the MD codes, and I kind of go a little bit off label. Sometimes I mix my fillers and I create little different volume densities with slightly different rheology. And biomodulation to me is still, I just feel that I haven't seen results that have really blown my mind ever with biomodulators on their own. And what we have available in the clinic is Sculptra. We actually do quite a lot of harmonicas. I know that's not too popular in Europe and Australia yet, but we do inject harmonica. We've seen a few delayed onset nodules. I know you spoke about that recently, Jake, on the Patreon. So, I'm a little bit more conservative with those products. I don't like to use them too aggressively. And some people really need a little bit of skin enhancement. And I do use them, but I'm a little bit more conservative with them. And then the extreme, thread lifting with polydoxine threads, we used to have Anchor and Anchor Max. I don't actually do that anymore. I find that thread lifting and those really extreme results that don't last very long, I'm not a fan of that. I'm more about progressively understanding the patient and giving them, sustainable results that aren't that extreme in terms of gratification. If that answers the question.
No, definitely. It's a good little insight into your world. And just to pick on one or two things, the harmonica, for people who've never heard of that, it's a hybrid filler by Allergan. So it's a mixture of calcium hydroxyapatite and hyaluronic acid. So we don't have it in Australia yet. But it's been super popular, at least in the UK, Brazil, certain territories. It's very, very popular, and I can't wait to get my hands on it. I've done the training 2 years ago in London, but we don't have the product here. And I'll actually be going to New Zealand in October because we'll be doing an advisory board on it, so I'll learn more about it. But yeah, interesting what you said about threads. I think 90% of injectors we've had on this podcast have said basically the same thing. You might get an initial result the cost versus outcome or long-term outcome for the majority of people who've asked is the same as what you said. I've never played with lifting threads to any great extent, so I'm always interested to ask what other people say. And I'm really put off because everyone keeps on saying the same thing. But, you know, we find the odd person, like I know Laurie, who we've had on the podcast, she loves them. And so does her colleague. And he came to Australia recently to teach from Mint Thread. So maybe there's just really expert practitioners and they know the secret that we don't. I don't know. But yeah, interesting. Any comments about
threads?
Yeah.
I mean, from what I've heard, a lot of it comes down to patient selection. I think there's certain demographics that tend to respond better. They've got different tissue, the threads tend to hold better. But again, I'm not a practitioner, so I can't speak from personal experience, but I think it's just like not every tool is going to be, you know, appropriate for every patient. And I think that people just sometimes think that every tool is applicable. You just, you know, it works on everyone the same, and that's simply not the case. I think it's just another tool in the arsenal.
Yeah.
People will believe in it, some people won't. I think it comes down to probably patient selection. Probably.
Yeah. Let's lean into your, I guess, product selection a bit more. So toxins, and it seems like you have rightly decided to be a tox expert, and I totally agree. And David and I both think that 90% of injectors have kind of ignored almost the bread and butter of what they're doing every day. They're doing 3 areas, probably underdosing, trying to concentrate on filler to sort of drive their business. And I think they've got it the wrong way around, personally, because, you know, once you've done a couple of mils of filler in an area, it doesn't need it for years often. Whereas tox, it's the regular, it's the breadwinner, isn't it?
Yeah.
And then if you start doing off-label and treating some medical things like bruxism and migraines, where you're laughing from a patient satisfaction perspective, but also business perspective. So what's your favorite tox and why?
So we in Skin Renewal, we have availability only of Dysport and Botox, again. Honestly, I probably inject Dysport more often. I find that the diffusion, I like that it diffuses a little bit more. I like that it gives that slightly softer appearance. Like, I find that it just gives me, especially for younger females who I see a lot of, you know, like younger, starting to like their neurotox journeys. So I find that they like the feeling of neurotox when they've had that for the first time. So I probably use that a little bit more regularly than Botox. I like using it in hyperhidrosis and bruxism. I definitely use Dysport way more regularly. I think it distributes into the muscle a lot better. I also find people find that people really like the quicker onset a lot more. I find that Dysport often kicks in a lot quicker than Botox. So I'm using that a lot more regularly. We do have I think our dilution is a little stronger than what's recommended. I dilute it a little differently. So I hope that I think that it has a slightly better result in that sense. Botox I've been using as well quite regularly. I don't think I do anything too differently. I think I'm just the pattern of injection and understanding the way that the patient's face moves and understanding the anatomy rather than just using that template that we've been taught, the normal recipe that's given out in so many training institutions. So to answer your question, I use Dysport probably the most regularly. I've mixed Botox and Dysport before, or not, just to kind of see what happens. I haven't tested that on enough patients to kind of get the little bit of diffusion, more focused restriction of muscles where I don't want any diffusion. But I'm using those products. Those are the only 2 that we have in South Africa or in Skin Renewal. Now I know that Xeomin is coming into some of the clinics as well. But I think for me, it's been more about just understanding anatomy and injecting it really meticulously and looking at the way that the face moves and not just applying a recipe that's been taught to you because you think that this is going to give the patient the best outcome. And really listening to what they want to achieve from their neurotox. I think so often they don't really understand what neurotox does. They just want a result. And if you inject into them, they say, oh, I think I looked a little bit better, but they don't really understand that we're actually restricting muscles and antagonizing muscles to create balance and symmetry. So that to me is, and in terms of product selection, my favorite product, and I'll say this on air, is Dysport for now.
Yeah. What have you struggled with? What's been your greatest challenge or skill that you've sort of been trying to acquire? Because everyone's got something. Some things come really easily, others are more difficult. What's been your bugbear to date, or your most difficult skill?
Probably understanding depth.
Yeah.
Understanding the depth of tissue. We should all be doing cadaver dissections to see actually where we are in the tissue. I use a lot of cannula. I'm a huge fan of cannula versus needle. And I think initially when you start injecting, you kind of just stick the cannula in and hope for the best and hope that you're in the correct plane. But the more that you do it, the more you realize, depth is so incredibly important in terms of achieving the results that you want to achieve. So, and it's a difficult thing. It's a difficult thing that still challenges me every single day. So that's probably the big overcompassing thing that I struggled with initially. And once it clicks, and you kind of go through this like revolutionary moment. And then nasolabial correction for me is also something that I think is done unsafely and pretty unsatisfactory across the world, because it's such a common complaint. I really find that so many people coming. That's the sort of the initial thing that I feel that most people present with. It's the line that they see, and it's something that we, using MD codes to give lateral volume and lateral support to the face, we tell the patients that your nasolabial is going to kind of soften. But I haven't really found a technique that I feel works incredibly well. I've tried Tom van Eyck. I know Tom van Eyck was also on the podcast a little while ago, and he does the ferning technique. And I find that was quite incredible to try. I really think that worked quite nicely. But I haven't found my own technique that I feel I can tell patients, this is going to work incredibly well for the nasolabial. So that's a challenge to me.
Why do you think people focus on the nasolabial? Why does it bother them so much?
It's just, it's probably the most, the line that I think people probably see the most in terms of their selfies. So we're photographing ourselves a lot more in modern time. And I guess it's something noticeable. And it's probably just that one deep line that people kind of start to see coming as they get older. They don't really look at their temples, and so they see their glabellar lines and their nasolabials, and then they kind of associate that with aging because it wasn't there before. So that's the best answer I've got, I guess.
Yeah,
it's interesting. I think patients see themselves very 2D. They look in a mirror and they see a 2D picture of themselves, and it's a crease, and they're like, well, that seems to be something that should be filled or could be filled. Why don't I go and ask if they can fill it? But they don't understand aesthetics, because you could do all the other things on the face and leave the nasolabial, and they'd feel better about themselves. Leaving a big crack on their nasolabial and they won't care. But I think it's the obvious thing. It's an obvious, sort of hollow or shadow. But I guess what I'm getting at is it's probably something I do least or last, or as a less of a priority compared to the other things. But when you're a new injector, it's often taught, because it's kind of, inverted commas, easy to do. You sort of, do this very dangerous thing where you put a needle in and you sort of fill it. And it's sort of intuitive for junior injectors that you're filling a crack, and hey presto, it looks less like a crack after, but it can look weird as well. So if you're listening and you're just starting your journey, just think about what makes someone look good rather than just filling cracks, I guess, is my takeaway point.
Yeah.
I think that sometimes what they believe will look good is so wrong. I think it's so important for us to educate patients that they say, my nasolabials are really deep and I want you to fill them. But you tell them, if I fill your nasolabials either anymore because you've done so much filler there already, or, if I do this now, you're not going to look better than if you leave them exactly as they are. So I think that for me as well, it's patient education.
Yeah.
And understanding the way that our faces age, so important.
100%. Now, I asked you about favorite toxin. Let's talk about favorite filler. Are you a Galderma boy, Allergan boy, something else?
So I know I've been talking about those two companies, but Reveness has actually come into South Africa, and we've been, for the last, don't quote me on this, but I think it's 8 months. 8 months now. We've been injecting a lot of Reveness fillers. Very recently, we got Reveness Pure, which is their sort of biostimulatory product that's not cross-linked. So nice, non-cross-linked product for skin integrity. But Reveness is really, really a nice product. They talk about wet milling, and the way that they produce their HA to give the least amount of swelling and the most spherical HA molecule. So that's kind of their stance. I'm not sure if you guys are using Revenus yet, but
we don't have it. Is it from North America? Is it made in North America?
It's Canadian.
Yeah, Canadian.
It's a Canadian product. It's a Canadian product. The company is called Prolinium, and they have a huge range. They've got really nice high G prime, great rheology, like shaping fillers called Revenus Shape. And then my favorite product, and I can honestly say this, is something called Revenus Contour. Essentially like 25 milligrams of HA per mil, and it's got an incredible density to me. I find that it volumizes chin and cheeks really nicely, but it's not too thick. So it's a really beautiful product. And I think that they're going to be big hitters in the world of volume replacement. They come in. The price point is also really good. So I think they're a really good product. And a really nice addition is that you get 1.2 mils of filler in a vial, not only 1 mil. You have that tiny little bit of extra volume that you can either do a touch up, or sometimes you need that little bit of extra volume. It's a really, really nice product.
Interesting. Yeah.
At the beginning of the podcast, you mentioned regenerative health, and you touched on PRP, and you had some of those treatments yourself. So where is that going in your clinic? What are the treatments that you guys are performing, and what's your interest, and sort of where do you think it's going to take our industry as we move forward?
I hope it's going to become a huge part of aesthetic practice in all med spas or cosmetic clinics or whatever we're calling them. But I think it's a really important part of regenerative health aesthetics, so the way that we look, and then regenerative health and the way that we're aging. At Skin Renewal, we have IV bar, so not IV bar, but we do a little bit of IV supplementation, which I don't think really fits into the regenerative sphere. The biggest treatment that we do is PRP. And we do PRP hair, we do PRP skin, we do PRP basically everywhere. And we have a nice little centrifuge machine. We actually just draw 20 mils of blood and spin it down in the clinic, and then inject the platelets back in the clinic. Other than that, there's not really that much happening in the regenerative sphere. We have a little bit of health renewal where we do, where we consult with patients and help them in terms of lifestyle management. We don't have peptides yet. We're looking at polynucleotide injections. So that would probably fall a little bit more into the regenerative health sphere, where we inject polynucleotides. But I hope it becomes a bigger practice. I hope that peptides and, everything that's coming out in terms of all these neuroscientists that are talking about all this stuff will enter into the clinic a lot more aggressively, and it will become a bigger part of our practice. And I need to learn more about it. I wouldn't safely say that I'm a professional in regenerative or anti-aging medicine just yet.
I don't think anyone is yet. We're all learning, so don't worry. But so are polynucleotides available in South Africa? Is it just that the clinic hasn't got them in yet, or?
We don't have them yet. I think Neostem I've seen is being injected in 1 or 2 clinics in South Africa.
Right.
And then there's another one, the salmon DNA derivative. I can't remember the name now. Regerin we don't have. We don't have. We don't have it yet, and I hope it comes in soon, because tear trough correction to me is so difficult at the moment, and I need a little bit myself. So I've been looking at polynucleotides underneath the eyes, and I think that it's a really nice place to inject polynucleotides. But I don't have any experience injecting polynucleotides yet, and I really hope it will start to come in a little bit more, with more availability across South Africa.
Yeah, look, the beauty is it's so easy. It's not really an artistic treatment. It's more a dose treatment, and getting people to buy into the protocol and dealing with a couple of days of downtime and some bruising. But it's a very easy thing to offer patients. So if it's the right candidate, any injector should be able to do it. Unlike, you mentioned the word tear trough, that can be tricky even for experienced injectors, getting the layer and the dose and the right filler and, understanding the anatomy. I totally agree that can be sort of less well done. I'm really interested to know about price. You mentioned that people are flying in for potentially a better deal. So you can only speak about your own clinic, but what do you guys charge? I mean, and how do you cost your toxins and your fillers?
We don't charge per area, we charge per unit. And we, for Dysport and Botox at our dilution, we charge 100 Rand a unit. So
I've got my
I think to
thing up
to the
here.
dollar.
So 100
Rand?
rand
South
is
African rands.
$8.30 Australia or $5.50 American.
It's cheap.
That's pretty cheap.
Yeah.
Yeah, that's
unit.
good.
And then a vial of, I'm not sure what filler I can. So Restylane lift would go for about 6,000 rand,
6,000.
and that would include the injecting as well. So that's just, you pay that for the product, and then obviously that includes the injector's technique and training
that's
and all of that.
decent
stuff.
price, 497 Australian or 333 American. Yeah, that's good.
Yeah, and our Reveness fillers are approximately between 5,500 and 6,500 rand for the 1.2 ml vials. And that includes so the patient pays a consultation fee, but if they inject at a price point more than 3,000 rand, that gets waived. So and that always happens. So that's the entire price that they pay for that entire service, which I think is, considering a lot of sometimes there's an additional surcharge for your skill or your level of expertise, but at Skin Renewal, that is the price that you pay, and that's what we quote them.
I think we need to fly to South Africa.
Yeah. Well, to put that in perspective, how much does a litre of milk cost?
so it's becoming more expensive, but a liter of milk now is like, for dairy avoidance for my skin, I don't drink much milk, but it's about 25 rand for
25
2
rand.
litre milk.
What is that calculator, Jake?
I just turned it off now.
It's always good to know. Put it in perspective.
25 rand. That's $2. That's the same as Coles. Exactly the same as Coles, actually.
I don't know, rubbish milk you're drinking.
Not the organic one.
Mine said it doesn't cost $2 a litre.
Yeah. If you get Coles, get the macro or the organic. It's about $2.60.
You're buying the out of date expiring ones with the special.
I bought it yesterday. I'm telling you now. It's about $2.60, okay, I think, unless I'm really out of touch. Just to finish off, you said skin quality injectables. There's one from Reveness, but which other ones do you have? And more to the point, what's the best one, and what are your patients feeding back? Because there's so much choice now. I know some injectors are a little bit disappointed, or their patients' feedback that they're disappointed doesn't last, or they don't see anything. Do you guys have Profilo as sort of an alternative? I would count that as a regenerative treatment. I mean, it's aesthetic, of course, but it's regenerative as well.
So the ones that we have Sculptra, we have Profilo, we have Restylane Skin Boosters, we have Vital and Vital Light. And then obviously Reveness Pure is the latest one in the clinic, which I don't have a massive amount of experience with. I find that Profilo, if you inject it with the biostatic points, that BAP technique, I find that it's a very much I call it the cherry on the cake. So like if patients are doing lots of, collagen organizing treatments, high energy devices, and they've got budget, Profilo will give them that additional little bit of hydration in the skin. I actually love Sculptra. I think Sculptra with the correct patient, if you're choosing the correct patients for Sculptra and they've got the budget to do it correctly, I find that it works really nicely. The Restylane Skin Boosters, I use them kind of all depending on what the patient needs. I find that these accordion lines actually respond really nicely because skin boosters can be injected very localized into those areas. But I do all of them. I find that, so if I have to answer your question, I think with correct patients, if you're choosing the correct patients, you need to assess your patient and choose the correct biostimulator. I'm probably using Sculptra the most. Right. If it's mixed correctly, I think that you can give patients beautiful results, and you get that little bit of tightening and a little bit of lifting, and I think that the skin looks a lot better. But I really encourage my patients to do enough Sculptra and to not half-heartedly do it. If they can't afford to do the full treatment and maintain it, it's almost not worth it. And then for patients who are doing treatments on their necks, if you add Profilo onto the treatments, I think that they get beautiful results in terms of those little lines. I know you use it a little bit in terms of injecting Profilo into these actual necklace lines. I've done that with a few patients and I find that it works quite nicely. So yeah, I can't say that I really prejudiced and predominantly use one. I really do try to use them according to what the patient needs.
Yeah, I mean, I think here in Australia, we think of Sculptra as a very different beast. We call it a biostimulator, whereas all the other ones you mentioned are sort of more superficially acting, hydratory, less impactful. Yeah.
No exosomes yet, so stem cells, nothing in that world.
We're not entirely there yet. Dermapen World is bringing out an exosome product, a topical product, and a glide for Dermapen. It's not quite in the clinic yet. So we haven't really got an exosome that we are either injecting or have topically. I know it's in the pipeline. I'm sure it's going to come in very soon, but I also don't have much experience. I've never really used an exosome product on my skin, and we don't have an exosome product in the clinic, and we're not injecting any exosomes yet. So not entirely there yet, but it's all happening. We're on the sort of verge of all of those things coming into the clinic now.
Got a question. We spoke about the demographic, and I know you see sort of mainly Caucasian, European, and that sort of market. But if you see a local black patient, etc., do you think that white injectors are armed with the skill to understand the aesthetic, the cultural aspects, or do you think some specialized training is needed? I mention that because we have an injector here called Agnes. She's one of our patrons. Shout out to her. I think she's from Zimbabwe.
Yeah, I think so.
She wants to sort of treat her own demographic, but here in Australia, and she's finding it hard to find the skill or the courses to give her a better understanding of treating Afro-Caribbean and, Black African patients. So how would you sort of answer that? And when you meet patients like that, do they feel that a connection to you, or would they seek a black injector, for example?
In terms of understanding the patient's needs and what they present to the clinic with, I think that as being a Caucasian practitioner in South Africa, the majority of my training and the majority of my clinical practice was with African patients. Mm-hmm. Because we work in the public health sector, we get massive exposure. That's basically only, Black South African people, give or take. So understanding their needs and communicating with them has never been a problem. In terms of the skill that we need to inject their skins, I don't think it's different enough to say that I'd need additional training. It's definitely different. It's highly volumized, like beautiful, high collagen density skin. Obviously, like I said before, with pigment issues. So I don't think I would entirely say I need additional training to inject them. In terms of understanding, as a South African person, as a Caucasian South African person, we're such a mixed race, a mixed ethnicity, mixed culture, and we grow up like this. So it's not something that's that we only get exposure to in the clinic. So as a South African, from my perspective, I don't think that you would need any additional training. It's becoming more popular amongst African cultures to actually do skin treatments, and actually injectables is a very taboo thing to them, or was a very taboo thing to them, and they're becoming much more comfortable with injecting and actually using neurotoxins and neuromodulators and HA fillers and stuff. So it's growing in popularity. But to answer your question, I don't think that we need additional training. I think I'm comfortable understanding and injecting skins, but it definitely is a challenge, and there's definitely something different, not entirely the same.
Yeah, I mean, the analogous, I guess, example here in Australia would be we've got a big Asian population, Chinese, Korean, Vietnamese, etc. And, we see all sorts in our clinic, but yes, predominantly I'm seeing middle-aged Caucasian women. So that's just how it is, because that's the demographic sort of locally to my clinics. Of course, we can be upskilled in, seeing different faces. And I think it's important to sort of understand some of the, the basic differences. But also many Asian patients would gravitate to an Asian doctor because they've just got that affinity. Mm-hmm. They might speak in Chinese or prefer to speak in Chinese, or just understanding some of the cultural nuances of understanding their skin better. That's a big one. Just like you said, Black Africans would suffer often from pigmentation. And so seeing someone who sees that high volume every day is going to have more experience than someone who sees it occasionally. So yeah, it's interesting.
Yeah, totally. So you joined our Patreon not long ago. What are your thoughts so far of the madhouse and all the conversations that go on? I struggle to keep up with it myself, to be honest with you. I think Jake's some sort of superhuman freak. He manages to be everywhere all the time. I'm a mere mortal, unfortunately. But how are you finding it so far? Are you finding it beneficial to your practice or connecting with people around the world?
Absolutely. I should just have a platform to kind of feel comfort in that other people are going through the same things that you are, and having a platform to kind of discuss just questions that you might have that you have no one else to ask. I think that that's so important. And there's no platform in aesthetic medicine that really gives us that opportunity to, I have this patient, I need some help. And medicine is all about that. It's about referral networks. As a GP, you're referring to specialists all the time. Specialists are always communicating amongst each other. All the pulmonologists or cardiologists of the world are not just doing everything on their own. They have a network of people that they're communicating with. So to me, that's huge. I think it's such a massively beneficial thing to have just a platform to put your mind at ease. I've got this complication, or I've got this product and I don't really know how to use it. And to have that platform is really a privilege. In Skin Renewal, we actually have a WhatsApp group as well between all the doctors. So we have a very similar model where we can discuss patients and incidents and negative outcomes, good outcomes, whatever. It is a madhouse because obviously everyone's on their own train and there's not really a focused line of thought. But to me, the Patreon and the content that's coming out there is so good. It's such a nice thing to have professionally made, reputable content. And I really like the part of the Patreon that puts out the published articles or the actual literature. I've read through every single article. I think every single article on the Patreon, because it's so difficult to find those things and to refine them. It's not an easy thing to search for, and you're never really that sure if it's reputable or if the science and the evidence that's being presented to you is good, or if it was a study of one or two people with someone that was just trying to, get their name onto a paper. And I find that you guys have organized a database that's really helpful. I can't encourage it enough for all injectors to have something like this, a platform where it's reputable evidence. And it's highly skilled people that are teaching techniques that are real and giving evidence for that. So to me, that was a huge thing. And then the WhatsApp group is hectic, but it helps.
Yeah. If you get bored at 3 a.m, there'll be someone there ready to talk to you. So that's good.
Absolutely. If you need a friend at 3 a.m, we got you. Yeah.
No, thanks for the feedback. We appreciate that. Talking about, I guess, digital presence, your own social media. I want to talk about that because you've got quite a strong game. You're doing well. You look like a male model sometimes. So, joking aside, tell us about your strategy and how do you use that, I guess, to feed into your business, or do you not? Is sort of Michele the individual different to Michele the injector online?
So for those who probably haven't seen it, the name was probably a drawing point and quite an interesting name. So obviously, Grab by the Balls comes from my diagnoses. It was a time that I was doing chemotherapy and I was out of clinical medicine, and I had time to create this little platform where I could just help people to understand better about my story and hopefully create a little bit of public health knowledge about testicular cancer and what to look for. But as someone who likes to voice my opinion and someone who obviously likes thirst trapping on Instagram, and I talk about this openly because it is what sells. But having a personal brand with a good following that's engaging is so powerful to any business. No matter what you're doing on your Instagram, if you've got people's attention, you've got business. So with Skin Renewal, obviously Skin Renewal has their total entire social media team and they produce all of their own content. So it's not my company. So I don't channel too much of my personal Instagram or social media into that company, into the company that I work for, but it definitely aids my practice. A lot of people communicate with me on Instagram and then indirectly book via Skin Renewal to come and see me in the clinic. So that's huge. And I, not only with your own business, having attention on social media is a really powerful tool, and you can obviously misuse it, and hopefully I'm not, but you can put a lot of education out there. You can channel a lot of things towards your own business or the company that you work for, no matter what practice you're doing. So that's what I try to use that profile for. To be honest, I haven't been as active as I would have liked to be with in terms of public health awareness and creating a little bit more knowledge around testicular cancer. But I do think that's also my healing process. I went through a period where I was putting out a lot of information about my journey, about chemotherapy, about the healing process, about what it means to have an orchidectomy and life after cancer. And I'm probably going to start changing that profile into a way more aesthetically driven or aesthetic business, aesthetic injecting platform, so that I can educate people about this part of my life. But your followers will never leave you. The beautiful thing is, no matter what you're doing, if you've engaged them, they'll stay around, and then you can channel it into whatever part of your life that you're doing.
Yeah, look, Instagram's changed a lot, as we all know, over the past couple of years, and seems like every 5 minutes there's a new tweak or a new function. It's sort of driving me mad, to be honest. But what do you think are, I don't know, your top 3 tips for people listening who are frustrated? And number 1 is obviously consistency, but 3 other things that you think are really important with posting.
Just stay true to yourself. I think that, so many people try to follow what's happening. They're like, let me post something that I think is going to go viral because, either they read it somewhere or so. So for me, what I never really understood why the page was growing so much. I just kept posting things that were interesting to me and kept writing things that I wanted to tell people. And I stayed true to that. And the engagement comes. If you just consistently, like you said, stick to what's true to you, and not putting out things that are not true, just at the expense of trying to go viral or trying to get more likes or more followers. And the second thing is post about stuff that you're good at, things that you actually know a lot about. If you can put informative things out there that you know a lot about and that you're not just faking it until you make it, that people are really receptive to that. And I think it comes across quite clearly when there's honest and good information being posted. And it sounds so bad, but like, put yourself out there. I talk about thirst trapping because it's a real thing, but people like to see a genuine and authentic you, and they like to get engaged into your life. And I do that with, my selfies and what I'm doing with my day, but it's authentic and it's a part of me that I know people like to get engaged with. So, posting about my clothing or my outfit or whatever, my cool haircut, it's authentic, but people like your appearance and the way that you present yourself. So it's a difficult thing to answer in terms of that way, but putting out content that you're proud of in terms of yourself, people really like that.
Yeah, good advice.
And I think
I should do more of that. I'm terrible. I'm the worst social media person ever.
I'm just going to say it now. You're never going to do it. So
I need a coach. I need like a social media coach.
We'll close this one out, Michele, unless you think there's something else that we've missed that you wanted to talk about.
From my side, I think I just can't stress enough that it's such an exciting industry that we're in. And I'm consistent. I feel like every single day I'm consistently growing and learning. And I hope there's a lot of other people out there that are actually passionate about, or as passionate as me, about making this industry into something that's more tangible and more professional, so that we can look at it from a point of, not just a sideline career, but it's actually something that we have guidelines and we're achieving things that are standardized, not entirely standardized, but there's more focus on making this a reputable profession where we're wholeheartedly going into it and really showing people that we can make a difference with aesthetic medicine and not just create a case of vanity or looking better. And if I can get that out there, I think that'll go a long way. And
I think I know the answer to this final question, but what advice would you give young South African doctors if they want to learn? You're going to say go to your clinic because it sounds fantastic, but anything else apart from that? I mean, are there any other courses, conferences in South Africa that you could sort of speak about?
So in Skin Renewal, we've because my training has been so internalized, with Allegan and Galderma putting a lot of effort into also training us. I know that there's a fantastic cadaver dissection course, and Isolda, who was with you guys as well, is kind of managing that. I think that is an absolutely fundamental way of learning about anatomy. So what I would say is just take it slow. Don't rush into trying to do too much and trying to inject, too much product interface. Take time to learn the basics and understand anatomy extremely well. Do a cadaver dissection course and spend a little bit of time in a clinic making sure that this is what you want to do. Don't go into this industry purely to make money, because you see it as a side profession where you can find this extremely expensive product that people are willing to pay a lot of money for that doesn't seem that complicated, because you just stick it in and inject it and then this person pays you a lot of money. Really make sure that you want to do this and you want to give patients really good outcomes. And if you find yourself enjoying it and loving it as much as I do, then dive deep and make it your entire profession. But don't do it half-heartedly. I hope that people will hear that. It's a true profession, and it's something that needs a lot of attention and a lot of time.
Good advice. Now, we always end Injector Diaries with some stereotype questions, and then there's a final question from our previous guest, who was Rebecca Goodell. So we'll start with our sort of regular questions first. How many vascular occlusions have you had, and I guess what facial areas, and what was the outcome?
Luckily, touch wood, I've had none. I had a scare with the lip. I did a lip with a cannula, and the next day the patient came back to me and there was like a little bit of blanching here, and I thought the capillary removal was slightly diminished, but the decision was to leave it, and it perfused beautifully, and I didn't have to do any intervention. I've witnessed a nice facial artery occlusion with a cannula in our clinic. One of the other doctors was injecting cannula and immediate blanching.
Wow, okay.
So we had the Clarius ultrasound and we put it on there and we injected a lot of hyalase. So it wasn't me, but I've seen that in the clinic and I've helped to manage it. Mixing hyalase and using the ultrasound. We couldn't really see the occlusion with the ultrasound, but we managed it, and she's fine. She had quite a hectic experience, but everything's perfused nicely, and she didn't really lose any tissue. So yeah, those are the two that are very memorable to me. But I haven't had any massive complications.
Cool. Right. Best aesthetic conference that you've been to, and why? Why was it the best?
In terms of conference, probably Elegant Aesthetics. Sylvia Goldwowski, I can't say her surname. She did a talk on toxin. She came to talk to us, and that was one of the best talks I've ever had. Her approach to neurotox is so beautiful. She's obviously working with Elegant, so it was a Botox talk, but she did talk a little bit off-label as well. And just her approach to creating symmetry with Botox, not only chasing lines, but balancing the face with muscles that antagonize each other. If I have to think back, that's the one talk that I will never forget. It really changed the way that I approach neurotoxin.
Brilliant. And a bit of a self-indulgent question, but what's been your favorite episode of Inside Aesthetics and why?
So I went back on this question, and I really enjoy all of them. One of the most enlightening ones was probably Julie Bass. Julian Tajubi. I really enjoy her. I think that the way that and I love that she's not a doctor and she's a nurse practitioner, and she's so indulged and so good at what she does. And I love the way she speaks. So I really enjoy all the podcasts. The last sort of 10 podcasts have also been incredibly informative and incredibly good. I love Ben Tali, that whole talk on the Patreon. I really think that his approach to understanding products and the way that he describes collagen was really important. But if I have to say, it was probably Julian Juby.
Jubilant Julie. Shout out to Julie.
Yeah, he would probably like the Michael Caine one as well. You want to listen to that one if you're a tox man.
Oh, yes.
Yeah.
Rebecca Goodell has kindly left you a question. Now, she didn't know it was going to be you, so you're going to have to do the same thing in a moment, so I hope you're ready for that. So the question that she's asked was, God, I must be getting old because I can't read that. Was there a time in your life where you've taken a chance but you doubted it was the right decision, and how do you reflect back on that choice today? Very philosophical.
So does she mean in terms of an aesthetic procedure?
No,
I think it's just
anything.
General. Just whatever, any decision.
I guess like a crossroads in your life where you weren't quite sure, and obviously you made a decision one way or the other, and how do you reflect back on that decision?
It's probably very pertinent to the discussion, but probably to join Skin Renewal, the clinic. At that point, I was still in general practice with not entirely certain if I was going to indulge my entire life in aesthetic medicine. And in Skin Renewal, we only do aesthetic medicine. There's no other component to it. And there's a lot of pressure from your peers. None of my friends went into aesthetic medicine. They all started subspecializing and went on to specialize. And there's a lot of stigma, and it's a difficult decision in your life. So that was probably one of the biggest crossroads. And I can't stress enough that it was the best decision I ever made. I love this industry so much, and I'm so passionate about it. So that was probably a point in my life that I had to make a huge decision about my career.
Yeah.
And I think I made the best possible decision.
Excellent. Now, it's your chance to leave our next Injector Diaries guest a question. It can be anything you like. Could be about aesthetics, but a bit boring. Do something else. And we know who it is, but we're not going to tell you. But it's a he. That's all I'm going to say. It's a he.
Who is the most important and influential person that has guided your decision-making in your life? What is the one person that you feel has been the most influential and important in defining you as a person in your life?
That's actually a very good question for this person because he's got an interesting background with lots of influences. So it'd be interesting to see who he chooses.
Okay.
I think I know who it would be. I think you know who it would be.
I can't remember who the guest is. So you have to...
Okay. Don't give the game away. Okay, good. Perfect. Well, Michele, we've really enjoyed talking to you and getting to see you properly rather than just through text. But I'm going to hopefully see you in America. I'm trying to organize a better discount for our listeners to get to AMWC North America. So hopefully I'll see you in Miami. But if not, we'll see you, I don't know, somewhere else on the merry-go-round of aesthetics, AMWC, IMCAS, or one of these other events. But thank you for your time and sharing your story. It's been really insightful.
Yeah, thank you. It's been great and love to connect with people all over the world. We don't often get to talk to South Africans. It's only our second time. So thank you very much.
From my side, I mean, honestly, from the bottom of my heart, thank you for having me. It's a huge opportunity for a young injector who's just starting out. We have to remember that I think at this point in your career, you think you're the best. You think I've just come through training. I'm so confident with everything. I'm getting great results. But just to bring it back down and have this opportunity to be on this podcast, it's by far my favorite podcast. You guys are so insightful, and the guests that you get are truly helping us to learn. From a junior perspective, just some feedback. Honestly, the amount of knowledge that I take out of the podcast is unsurpassed. It is a truly informative and very professional podcast. And it really helps me to grow as a very passionate aesthetic doctor. So thank you from the bottom of my heart. Thank you for having me. It's been really lovely to chat to you guys this morning.
Thank you.
It is our pleasure. Well, we'll speak soon. Take care, mate.
Ciao. Thank you.
For our latest news, follow us on Instagram at Inside Aesthetics Podcast. If you want to get in touch with myself or David, follow us on Instagram as well at Dr. Jake Sloan and David_Inside Aesthetics. Join our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, live and interactive Zoom sessions, hints and tip videos, webinars, and more. Head over to www.insideaesthetics.com/Patreon for more information.